Okay, so I wanted to talk about this topic, and it is, why is it so bad for nurses to be stuck with a student nurse? Um, in some of the forums that I follow online, I have been seeing like seasoned nurses, people who have been nurses for a while, like bitching and complaining about having to have a student with them. And I don't understand why, because for one thing, I would think it would be a compliment for you to have a student with you, because that means that the administration of the facility, or like your nurse manager or something, um, or the school, thinks that you are knowledgeable enough or capable enough to be able to explain things and teach someone how to do things the right way. I would think that that would be a compliment. Um, I don't I don't really understand, like, some people in the forums will say that having a student slows them down, but I just don't get why that's necessarily a bad thing. um, like, I have done orientation with people before where I am like training somebody for how to work on the unit, and it does make your pace slower, but I would rather go at a slower pace and do things more slowly, but still be able to work as a team to get things done on time. Because that's how I do things with orientation. And I feel like it would be the same thing with a student. Um, because, I've I've worked with like new CNAs and things like that when they come to the job and they're new and they don't really have a handle on how things work or how to do things like with good time management. So I always give like my tips and tricks. I show them like how to do things and how to manage their time. I give them like advice on like the way that I do things, so then I'm not feeling like I'm completely rushing and losing my mind at the end of the night, or at the end of the shift. So like I just don't get why. Like, some people like to be by themselves. I totally get that. A lot of times when I am working, I don't really want somebody following me around everywhere, but it's temporary. It's not something that's going to happen every single day. And if you don't like teaching someone, or you don't feel capable of teaching a nursing student things that they need to learn while they're in school, then maybe let your administration or your nurse manager or supervisor or whoever know that you don't feel like it's a good idea for you to have a student with you because you don't feel capable enough. But just because they slow you down, that's not really a good excuse for why you shouldn't have a student nurse with you. Um, I feel like you should understand that the only way that these student nurses are going to learn is if they learn from somebody who's been a nurse for a while. And I would think that people would be a little bit more understanding about that. But like I said, everybody has their own routine that they like to do. And I know that some people that I've done orientation with personally, when I go to a new job or something, they tend to like really rush, or they leave me kind of to do everything by myself because they don't want me following them around, or they don't want me they don't want somebody like watching them work, which when you do orientation on a new job, um, sometimes like for the first day of orientation or for the first half of the day, I like to follow them around so then I know what's expected of me during my shift. And then, I'm fine doing things by myself. Or when I started working at the hospital as a CNA, um, I would, I followed somebody around for like the first day or so, um, on each shift that I was supposed to work. So for day shift, I would follow somebody around for the first day. So then I kind of got the hang of what happened during that shift. And then the next day, I was comfortable having my own patients. But a lot of people have an issue with being a preceptor or, whatever. however you want to explain it. I just don't get it, because I feel like, everybody complains about being short-staffed, and everybody complains about, working short and not having enough people there. But when you have these students who are trying to learn so that they can maybe relieve some of the pressure that you're feeling from being short-staffed, then you have an issue with them learning with you. Like, nobody is saying to completely screw up your routine and your shift, but you have to understand that these students have to learn somehow, and if they're going to learn it from you, then you should be the best teacher that they have, because you've been there, and hopefully you're a competent nurse if they are trying to utilize you as a preceptor. I just think that people need to lighten up, and people need to understand that these nurses are not going to learn unless somebody who is competent teaches them and lets them learn and gives them those experiences that they need to become a good nurse. And it's just frustrating to see the mentality in nursing. It's so negative towards new people, and I don't get it. There's a nursing shortage. You should be welcoming and encouraging to anybody who comes up and has the balls to try to get into this pretty much ruthless field, because the saying that nurses eat their young is completely true. But that's pretty much all I have to say about it. Let me know what you think. Do you think that it makes sense for people to not want to have a student nurse with them? Like I said, what are your thoughts on this topic? If there's any other topics that you would like to hear me talk about or hear my thoughts on, if there's any tips, advice, anything like that that I can give you, let me know, and I'd be glad to make a video for you. And with that being said, that's all I have for right now, and I hope you guys are having a great day, and I'll talk to you guys again soon.